the T-cell lymphoma is very heterogeneous. It's driven by the microenvironment, which also means that you have T cells that are malignant, but also are supported by the microenvironmental T cells that have a dysfunction. And obviously, it's a big theme in cancer across, and that's why you have checkpoint inhibitors that have been approved, whether it's PD-1, PD-L1 inhibitors, or CTLA-4 inhibitors. So the story in T-cell lymphoma is the Pembrolizumab has been studied as a single agent, and that's a published data set which shows a 30% response rate. And both in CTCL and PTCL. In PTCL, it is 33%, and in CTCL, it is 38% single-arm studies. Clearly, when they looked at the microenvironment, and especially in the CTCL, when they did studies with Codex, which looked at the microenvironmental features and what the macrophages and the T cells are doing in the microenvironment, they seem to play a much larger role. So we should not forget T-cell lymphoma, it's not just the seed, but also the soil that needs to be addressed. And that's what Pembrolizumab does. And we then did an investigator-initiated study with Pembrolizumab with the addition of Romidepsin, because Romidepsin is an HDAC inhibitor, and many of the epigenetic signatures, such as the TET2, DNMT3, are predominantly seen in some of the subsets of T-cell lymphomas. So the idea was that the combining Romidepsin with Pembrolizumab, and also the Romidepsin upregulates certain checkpoint markers such as PD-L1. And we had an oral presentation at ASH the year before in 2020, and this investigator-initiated study, single institution study from MD Anderson. At that time, we had 20 patients on the study, and we saw dramatic responses. We saw 53% complete responses, even though the overall response was about 50%. And more importantly, the response was seen across the board. The ones that had the PD-L1 by immunohistochemistry were the ones who had the best responses in CR. There were a couple of patients who had progression of disease, and it goes to the point that the PD-1 biology in T-cell lymphoma is very different. It is a Nature paper from Germany that actually showed that PD-1 actually is a tumor suppressor for T cells, and it sometimes can exist in a haploinsufficient status. If it exists and you try to block the other PD-1, it actually enhances the T-cell responses. And so we have to be careful about that part in T-cell lymphomas. And one of the reasons why there are not many T-cell lymphoma studies is in ATLL as a good example, where many of those are in the PD-L1 haploinsufficient state, and it can push the T cells into proliferation, and we saw disease progression. So in this particular cohort of patients, we do not see this as much, and the responses are pretty dramatic. Now we have completed accrual. The last patient is on the study now, 39, and we'll have an updated ASH this year.